was playing college basketball and I hurt my feet. I had flat feet, went to several doctors and they told me, hey, you have flat feet, sorry, there's nothing we can do for you. I changed my career from being a math teacher to a podiatrist, and majority of patients are average arches, but there's about 30% of people that are born with flat feet, and even more than that have flat feet as they get older, because our arches start to collapse down. I was always able to do prescription orthotics for people with flat feet, and insurance companies were paying for them a majority of time. But as time has gone on, insurance companies aren't paying for them, and now we have patients that have flat feet and they don't have any solution for an over-the-counter arch support. So a couple years ago, I came up with a design that actually worked for people with flat feet. It's a design that we got a patent on in 2014, and over 90% of my patients can use j1i insoles without even having to go prescription, and we're able to relieve their pain in their feet, knees, shin splints, back, and everything. When I came up with the patent for j1i insoles, I wanted to have it that it was just not a flimsy little top cover foam type of piece of material that was being used for people. I wanted to have it as close to prescription as possible. So what we decided to do is use a medical grade plastic shell so that it's supportive, but it's not a rigid, like some orthotics, prescription orthotics are rigid and they don't have any bend. This is what we call a semi-flexible, so it has some flexibility, so your foot can come down to what we call a neutral position. Our design also, we correct in all three areas of the foot. We correct in the heel, the arch, and the forefoot. It's important to have arch supports, and the reason is that the entire body is affected. Your foot is your foundation, and if the foundation is off, the rest of the body is going to be off. And so when you step down, you should come down to a neutral position, and then you should be able to push off. But what the body does sometimes, and as the foot is breaking down and we have more and more weight and just the whole structure of our foot, as you're stepping down and that arch starts to collapse down, then we start having the tendon on the bottom, which is the plantar fascia, and that's the main problem that people have with their feet is the plantar fasciitis. So they step down, and then that pulls, it can pull at the heel, irritate the arch, and then as you're stepping down, then the leg rotates internally, and then that can cause shin splints. And then also, as the leg is rotating internally, the knee is now turning in. So the knee is being twisted. Instead of being a hinge joint going back and forth, it's now being twisted. So a lot of people get knee pain. That also then reflects all the way up to the hip and to the back, because now everything is off with that. We had a lady that had knee pain, and she was scheduled for surgery for her knees, and she didn't have flat feet, but she actually had average arches. And so we said, well, just try these, and but if you're still having problems, obviously have your knee surgery. Well, she sought us out at the next home show a couple months later, and she said, I had to find you guys because it's like, I didn't have to have knee surgery done, and it's all because of your insoles. I had a mother that came in, she had a 5-year-old son, and she was telling me about how every night she has to rub his legs because his legs are hurting so much. And so we fitted her for j1 juniors for her 5-year-old for flat feet, and she came back a couple weeks later and she couldn't believe that. She goes, within a couple nights he was going to sleep without me having to rub his legs, and he didn't have any more problems, and she couldn't believe it, and he was active again. That's what we want to do, is we want to improve people's lives. We have 2 styles, one for flat feet, it's our patented one, and then we have the average arches. These are affordable solution to prescription orthotics. People can afford to get these, and it can change your life. When you have over 30% of the population has flat feet, and there's not a solution for them out there except to go prescription orthotics, a lot of times are not made correctly or they can't afford them, then you have so many people, millions and millions of people that are out there in pain that are just going to surgeries or just being told, hey, there's nothing we can do, sorry. It's a huge impact, and it's my passion as a podiatrist and as someone that's been there to get this out to as many people as we can, and I know we can help millions and millions of people.